Curing COVID-19 is important, but what more important and necessary is taking care of yourself, your mental health. In a series of COVID cure talks with newsbharati.com, today with us we have Smita Kulkarni ji, who is a development consultant and a counselor. Having helped around more than 500 patients cure the COVID-19, Smita ji is here with us to tell us how we can overcome the fear and the panic that comes along COVID-19. Namaste, Smita ji. The COVID-19
Namaste.
situation, yeah, the COVID-19 situation, we all know across the state of Maharashtra and India is not that good. But to start with, we would like to know the seriousness from you, as you have worked in a lot of disasters. So, how do you see the seriousness of the situation today?
Yeah, see, actually, when there is any kind of disaster, may it be tsunami, floods, earthquake, any disaster, even a road accident, train accident, there is always some trauma, some fear. People are panicked, there's anxiety, and a lot of mental issues are recorded or noticed amongst the people. So, whenever there is disasters, you have to understand that there will be some mental health issues. Unfortunately, in India, we are not very serious about mental health problems, and we don't take them very positively. Even in
Ji,
routine case, if you have some issues with regard to anxiety, you will refuse to go to the doctor to talk to somebody because there is a lot of stigma attached to it. See, when this virus came to India, or when this pandemic started, it was not just a virus came from somewhere and it infected your body or your physical health, but there were some mental issues. So you have always have to consider that whenever there is a pandemic, it is just not a physical health issue, but it is also a mental health issue.
ji. Ma'am, we see people get, as you said rightly, people get panic, they get fear attacks in such times. So, however the situation is, how serious must people take it? How serious must the family members or the patients take it?
Yeah, actually, it is very serious. One thing I will just clear it. Those people who are very, they are mindful, mindfulness, and those people who are very resilient, they may not have long-term mental issues or mental
Ji,
health issues. They have ability to bounce back, or they have ability to think out of box, and then they are able to handle their own issues, their own problems, and they come out of the problem.
correct.
But 10% to 20% of people, they have severe mental health issues, and if not addressed at a particular time, or if they are neglected, things can be worst. And it will be not only worst for that particular person, but for the entire family, his friends, and he may destroy his family life and his professional life also. So in this COVID situation, when you have a person who is experiencing fear, or who is experiencing anxiety, who is undergoing stress, undergoing some kind of a depression. So family members have to address this issue. They have to talk to that person, and if they are not able to talk to him technically, if they are not that skillful, or sometimes it happens that the person doesn't want to open up with the
Ji,
family, they
ji,
should
ji.
definitely go to a person who is expert in this field, and they should address this issue immediately before it becomes a very big issue for that person.
Correct. Smita ji, coming to the very point of discussion today, uh, how can we consider the psychological aspect to the COVID-19 second wave today? And how important do you think it is to overcome the fear and panic?
Yeah, see, when we had this pandemic in last March,
Ji,
it was fear. That was the first emotion that was experienced. That everybody had fear, and this fear was somewhere. It was with regard to death. The kind
because
of
people
news we
didn't know
had
what
in.
exactly, people didn't know what exactly was
Yeah, yeah,
happening. Yeah,
yeah, yeah. They just thought that when there is pandemic, a lot of people will die, and that is what the
correct,
media brought from other countries. That is what we saw on medias, that graveyards are full of dead bodies, and doctors are struggling to save the people, and people are dying, and all that pictures we saw. So before
correct.
even Corona came to India, it was fear that we had in our minds, and we definitely have to take care of this emotion, because if this emotion goes uncontrolled, as I said, a person can destroy himself and destroy his family life and professional life.
Ji. Ma'am, what at the very basic levels can be done to overcome fear and pain? Now, suppose I am a
Yeah, see,
COVID-19 patient and I am undergoing the panic state more than the symptoms I have. So, how can I overcome that state of mind?
see, basically you have to, basically you understand, you have to understand this emotion, that is fear. It's basically a very, very powerful, primitive, and a very natural emotion. You know,
Yeah.
we all experience fear some or the other time in our life. Only
Ji.
the degree or the intensity of the fear is different in different situations.
Correct.
Sometimes what happens, it is real, or sometimes it is imaginary also. Because on the basis of my information, on the basis of what I have seen in the media, or maybe we have a WhatsApp university, so many things are coming in, and which are not really true. Sometimes they are just, it is just false news or false information that
Ji.
is being circulated. So fear is based on real experiences and sometimes on the imaginary experiences. The person who is undergoing fear, he has to take care of one thing. He has to bifurcate between, is it a real fear or is it something imaginary? I saw something in the on the TV, and then I'm suspecting that maybe I will die and something will happen to my dead body and something like that. So
Ji.
these things you have to really take care of, that whether the fear is real or whether it is imaginary. If you have fear, it is accompanied by stress, and once you have stress,
Okay.
many a times it happens that some hormones are released, and the stress and the fear is triggered in the person.
Okay. So, how does the fear and the panic state of mind affect the mental health in the overall
Yeah,
situation?
it's a very nice question. Especially those who are identified with positive, they have a positive status and they are quarantined or maybe they are hospitalized. So these people, we really have to work on their fear. And as a counselor since last March, I'm doing this job. See, when you experience fear, as I said, there are some hormones that are secreted and through which stress increases or it's triggered. And
Ji.
also there are some physiological changes happening in your body. So you will have heartbeats, uncontrolled heartbeats you will have, or maybe sometimes it is sometimes you will have some palpitation problems. You
Right.
will start sweating.
Hmm.
Yeah. So, and also the blood circulation in your body, it can be affected with this, and it can be endangering for your life. So basically, when a person is going for a treatment, he has to be physiologically, he has to be very calm and very soothing and very peaceful.
Ji.
So we have to tell him that whether his fear is real or imaginary, we have to work on that, and we have to, bring him to a normal stage. And that is the time when he starts reacting positively to the medical treatment. So
Ji.
after working for this long 1 year, yeah, today doctors are they are asking us to handle such patients who are refusing medical treatment or who are not giving positive response to the medical treatment. And when we talk to them, when we work with them, we find that this fear component is very strong in such people. So definitely you have to work on fear, otherwise you will not be able to take your treatment in a proper way. You will have longer period of treatment. And this is also, it has been noticed that when these people are very, very positive to the treatment, they are well, they come out of the hospital soon, and
Correct.
the
Correct.
recovery is also very speedy. Yeah, so
Correct.
definitely if you have fear, even to my listeners and viewers, I will tell them that if they have fear, they should talk it. They should try to understand whether it is real or imaginary, and then only they can think about something good and something very positive in life.
Ji. Ma'am, you have worked a lot in this situation. You have cured a number of patients till date since last year. So, do you have any instances to share so that our viewers and listeners can understand how this overcoming the panic and fear state of mind can help them overcome the COVID situation?
Yeah, yeah. Normally, the people who experience fear, we ask them to do few things, and basically, we have a therapy that is emotional. We normally what we do is we talk to them, and we exercise this therapy with them, and
Okay.
that is emotional behavioral therapy. That is the therapy we use with them. See,
Okay.
basically, basically, I had a patient. She was around 60 years old, and she was in a quarantine center in Pune, which was located near the river. So
Ji.
last year, somewhere in July, I think so, we had a lot of rainfall for consecutive 3-4 days.
जी,
And one evening, one late night, she called me and she said that, Madam, if there is flood, what will happen to me? So I was little shocked, why is this question from her?
hmm,
So no, initially I asked her that what is happening? Do you have any health problem? Is something wrong in the quarantine center? If somebody is misbehaving with you? So she said no. She said that I have a fear that if there is a flood, what will happen to me? So I said, how can the flood be there? It is very normal rainfall. It is not
जी,
really very the rainfall is not that big that you will have flood in Pune. And then I said that why do you think about this particular thing that you will something will happen to you when there is flood? So she said she had experienced some flood when she was a child. So as I said, that you have to teach your client to bifurcate whether it is real or
imaginary,
imaginary. So
correct.
it was something based on her, yeah. So something it was based on her experiences. Maybe when her in her childhood she had seen some flood, or maybe she was victim of that flood. So she was relating that incident to this incident, and she thought that if something goes wrong in the quarantine center, she will die. So these are some of the examples we have. So whenever we have patients who complain fear or who tell us about their fear, we teach them this, and we normally exercise this therapy with them.
जी. Ma'am, I would like to mention here that this is the third interview we are taking in the COVID cure series on News Bharati. So, in past two sessions, Dr. Kekar and Dr. Akalpita Paranske they mentioned that yoga and meditation and homeopathy, Ayurvedic medicines can somehow help in this uh, COVID-19 cure. So, what do you think about yoga and meditation helping in the psychological aspect?
Yeah, definitely. See, when any person who is undergoing any kind of mental issues or emotional issues,
जी,
uh, you have to relax your brain first. You have to work on your mind. Yeah. So, to the best way to work on your mind is you have to focus on something. You have to do single activity at a time. You have to do your proper exercise. You should have your proper sleep. You should
yeah,
have your proper diet. If you have any physical problems, you should be having medicines for that. And also we suggest when I say about exercises, we suggest them yoga, we suggest them pranayam,
yeah,
different things we suggest according to their age and their physical capacities. So it really works. And
yeah,
all those who experience fear, all those who experience anxiety, who have mood swings, they should go for yoga. It is the best exercise they can do.
yeah. Ma'am, also the food habits play a major role in settling the mental state. So, can you suggest some of the food products or food items, homemade food items or dish like food products to help the patient's cure?
Yeah, actually, as I said, that you should have proper diet.
Yeah,
When I say it is proper diet, if you talk to any dietitian, she will tell you that your plate has to be colorful.
yeah,
That means that red tomatoes should be there, white rice should be there. All colors should include your plate. Fruits
yeah,
should be there, milk should be there, milk products should be included in your food. If you are a non-vegetarian person, you should have fish. You can have eggs. So I think so. Whatever you eat, whether you are a vegetarian person or a non-vegetarian person, what I mean to say is you should include all fats, proteins, everything should be included in your dish, in your plate.
जी,
And that too you should have at proper intervals. During this lockdown, especially during the first lockdown, we lost all our habits. And
yeah,
basically what happened is, yeah, the moment we had lockdown, the same moment, our timetable was disturbed. In
जी,
the earlier phase, I used to get up at 5 o'clock. I used to cook. I used to go to my office. I used to have my food at 1. I used to come back at 6. I used to have my tea, my dinner at 9, and I used to sleep by 10. But during lockdown, what happened? I didn't have to go to office. My kids were at home, so we would have our lunch maybe at 2 o'clock, dinner at 11 o'clock. We would watch a late night movie and go to sleep at 2 o'clock. Then
जी,
next day we would get up at 10 o'clock.
जी,
So the entire timetable was disturbed. And if you have a disturbed timetable, you can have mental health issues. So all those who have mental health issues, any kind of issue, any kind of emotional problem, they should first thing they should do is they should follow their daily timetable.
जी,
Whether you are working, whether you are going out, whether you're not going out, you should have a timetable, and that should include good sleep, exercise, some hobbies you can develop, or if you have
Correct.
hobbies, you can continue with them, you can learn few things. So this is very important for your mental health.
Ji. Ma'am, as you mentioned that mental health is very much important, but also being quarantined and the lockdown situation is very much important. So, what are the effects? What can you state the effects of quarantine and lockdown on the mental health? Negative,
Yeah,
positive,
see,
whatever it is.
yeah, both I will tell
Yeah,
you. Positive, I'll tell you first, because
Ji.
as a counselor we are always supposed to be very positive. In Marathi we say
Correct,
ashavadi. Yeah, so
correct.
positive is, we are with our family. Yeah, we are with our family. We have lot of time to talk to each other, interact with each other. I have lot of time to tell my kids some stories, some experiences, and my husband is helping me out in cooking also. So many good things are also happening. We are giving time to our relationship also, which we were not able to give in the previous times, because we had no time at home. We were always running behind our work. We had to go out and do a lot of things.
Ji.
These are a few positive things, yeah, but negative things are there definitely. A lot of people even today, they have a sense of fear in their mind, that whether this now we are talking about third strain is coming. So again, that
Correct.
is something, will it be same, will it have same issues, will it
Also
have
the
more
economic,
mortality?
yeah, also the
Yeah,
economic and
also
financial things
economic.
add. Yeah,
Yeah. One thing I will clear here, that all those who had a good financial status, they enjoyed this lockdown with the family. But just think about the people who are working in unorganized sector. Think
correct.
about the migrants who had to walk, so many kilometers back. They had to walk to reach their homes. So problems are there. There was anxiety. There is anxiety. There is depression. Mood swings are there. Lot of people, just because their timetable is disturbed, so they are having lot of issues now, mental issues, because earlier we had our timetable and we had mind working somewhere, it was busy somewhere. But now it is, you say that it's a devil's mind now. You don't have work to do, you don't have anything planned to do. So
Yeah,
this is definitely impacting negatively on people's mental health. See, one thing is, everybody is facing, even kids, small kids, they cannot go out and play. They have missed their schools. So many kids, they come to me and they tell me that, madam, please tell my mama or daddy to take me to the school. At least let me see my school, how it is. So
yeah,
there is also, they're missing social life. See, in the earlier times, before pandemic, when I didn't have a good mood, I would just go to Tulshi Bag and have a just window shopping, and I
correct.
would be refreshed. But today, my social life is, it's come to an end. I cannot, no marriages, no religious celebrations, no get-togethers, no parties.
Yeah,
There's no social life, and we are social animals. We cannot live without social life. We want to meet people, we want to interact with people. And just one day, that lockdown came and everything was closed,
yeah,
without any preparedness. We were not prepared for that. We were not
correct.
told that you have to do this now and get prepared for this. So anything that happens in an unprepared situation, it is always something that creates trauma or panic or fear in your mind.
Yeah, and now that we are prepared for the lockdown situation, there's a fear that this should not become the complete way of life in the future as well.
Yeah,
So, Smita ji,
yeah.
speaking about the COVID-19 stress here, I suppose that it becomes really difficult to manage the patients and the family members at such times. So, what message would you like to give to the frontline warriors or the media or the doctors, all those external indirect forces that affect the patients and the family members?
Yeah, on this occasion, I will definitely, first thing I will do is I will pay a very humble homage to all the frontline warriors who have lost their lives, and who are contributing wonderfully for the health sector, and they are no more with us. And I'm sure globally they will always be remembered for what they have done during this pandemic. One thing is very important, that all the frontline workers, frontline warriors, they are under tremendous tension and tremendous stress. If you Especially if you look at police, the uh, uh, medical people, the people working in the medical sector, even the people who are doing our cleaning job, swachhata karmachari. So it was very difficult for them to continue their job. And we did have some workshops with them, and we did teach them some skills to how to reduce their tension, how to reduce their fear, or how to remain very calm, very cool. So such skills need to be taught to these people. In the free time, what they should do is, whenever they get free time, as I said, proper diet, proper sleep, exercise, this is important. This is important for everybody, whether you are undergoing any mental problem or not going undergoing any mental problem. But what these people can do is, if at all they have any issues, they should share it with somebody. Hmm?
Correct.
We have a term which is called as that is emotional. Emotionally, many a times you don't open up, especially men. If they have any fear, there's a stereotype images we have made that men should not do this and women should not do this. So men are not allowed to cry, men are not allowed to tell their fears, men should not discuss anything that is very painful. So it is not really that. Yeah, we all are human beings. Even if the male front warriors, if they have any problem, mental issues, they should talk to somebody, maybe their family, maybe their friends, maybe their office colleagues. And if they are not happy with this, or if they don't find a solution, they can always meet a expert person. They can meet a counselor, and counselor can definitely help these people,
Yeah.
because if they are burdened with this kind of tension, they will have physical problems also.
Correct.
Maybe they can have some
Possibly. Yes.
cardiac problems, or maybe some other problems they can have, and we want them to work for us. So we are definitely we want to help them, and they can meet any counselor or any doctor who is practicing mental health. They can meet those people. Secondly, whenever they get time, they can move into nature. Maybe they can do they can practice some hobbies, or maybe they are, many a times you can play a flute, or maybe you can play a piano or something like that. You can sing a song, or maybe spend time with your children. Children are best stress busters. So if you are under stress, you should talk to children, play with children. It's not always your kids. Maybe you can talk to some other kids also,
Correct.
whomever you meet, or
Correct.
you stay in a particular society, you have kids around. In this particular pandemic, it is little difficult, but at least you can talk on a video call, or maybe you can see some, you can crack some jokes,
Yeah.
and you can laugh over it. One more thing I will tell you, that during this pandemic, we really get very few moments where we can enjoy and laugh, because the situations are so bad outside. But we should find, or we should explore some opportunities where I can laugh, and literally giggle,
Ji.
giggling, what you say, yeah,
Ji.
laughing, you should do. Because what happens is, the saliva in your mouth, it secretes something called as antibacterial compounds, and they
Okay.
help in reducing your stress. Yeah.
Okay.
So
Okay.
laughing is a very good exercise for people who are under stress and who work in stressful situations. So
Yeah.
they should find an opportunity. Yeah.
Yeah. Ma'am, talking about the age group, as you mentioned, that children are the best stress busters. So, how difficult or easy it is to manage the patients who are either children or patients who are above 60 or 50 age, as we can see.
Elderly.
How
Yeah.
easy or difficult it is to manage these patients from the
Yeah. Yeah.
psychological aspect, of course.
Yeah. Before I answer this question, I will just add one point for the frontline warriors.
Yeah.
Many a times when you have anxiety, you move into addictions.
Yeah.
It can be any kind of addiction. So I would advise everybody that if you are in a tension, if you are experiencing anxiety, talk to somebody. Addictions are not the solution.
Yeah.
Things will become worse.
This
Yeah,
is
and
very
I find
important.
many people, yeah, and I meet many people, frontline workers. They very openly tell me that they have a lot of tension, lot of stress, and then they can't go to sleep, and all this happens to them. So they are, they are into some addiction. So it's my request, it's my advice, that please don't go for addictions. They will make your mental health worse. Yeah. So one thing you have to really remember. You were talking about children and how we deal with elderly people.
Yeah.
So we also work in some quarantine centers, especially a center which is run by Janakalyan uh, Samiti in Pune. So in this quarantine center, we have little kids coming, and we also have elderly people coming. We have all age groups, who are admitted in this center. But I think children below the age of 10, and senior citizens above the age of 59, they are the best people who take this, and they enjoy it, and they make their mind that they have to be good, they have to improve their condition, and they have to go back to the family. Yeah, so we really take very little time to make them comfortable, and they take very little time to be adjusted in this quarantine center. Small children, of course, when they come alone, they cry for a few days, and they want their mother or father. They'll keep asking, "Where is my ai? Where is my baba?" And then we have to tell them that just they will be coming. I'm your maushi, don't worry. Something like that. We have to tell them. Sometimes we have to tell them stories, or maybe we give them some material, drawing material, some paints, colors, something like that. So we ask them to do some drawing, or maybe some activity we give these children. But after 2 or 3 days, they are absolutely comfortable, and they keep comforting us. That how are you, Maushi? I'm fine, and all this they will talk. Even elderly people, first 2 3 days they feel neglected, they feel lonely, they feel that they're not amongst their family, or sometimes they even fear that if I die, I will die in this quarantine center, not in the midst of my family. So this fear is there, but then we explain them that no, no, this is not your stage. You are much better. You have tested very, you have tested, and you are under our medical treatment, and you will be taken care of. You just have to rest and give positive response to the medicine. And in the later stage, they are the ones, sometimes they suggest us few things, and they have their own group, they chat with each other, and many of them, they carry their mobile, so they enjoy bhajan, kirtan, so many things. So I think they are the best people, these kids and the elderly people, who don't trouble us. They
Mhm.
adjust it very fast.
Yeah.
Yeah.
If you say so, ma'am, I suppose that it is difficult to handle the people in the middle-aged group. So why do you think, what are the basic problems the middle-aged people face? What are your observations?
Yeah. See what happens, if you talk about the elderly people, they have almost finished with their responsibilities.
Yeah,
And the younger children, they are responsible. Somebody has to take their responsibility.
yeah.
So once they are okay with the environment, they don't find it very difficult, uh, just staying there.
Mhm.
But with the middle age, what happens, they have a lot of responsibilities. For
Mhm.
example, I'm a housewife, and if I'm admitted in some quarantine center, I have my kids at home, my in-laws at home, my husband is there, and they
Correct.
don't know how to cook. Then who will take care of my household duties? So
Mhm.
many things are there. Or if I die tomorrow, what will happen to my kids? In case of male members, what will happen to my job? If the person comes from unorganized sector, then he has a double tension, that as it is, I have lost my business, and then again I'm quarantined for 14 days, and now I have to go back and I have to start with my business. One thing I will just share with you, that this pandemic also carries some kind of social boycotting. In Marathi we say samajik bahishkar. In
Mhm.
the first
Correct.
phase, it always happened that nobody wanted to tell that I am a positive person,
Yeah,
or
yeah.
nobody wanted to declare it,
It
that
happens
even
even
now,
today.
even
Yeah, it happens
yeah,
even today.
even
Yeah.
today, even today. So in the first phase, this stigma was attached to this particular pandemic, and therefore people didn't wanted to declare where they were, what happened to them, and even if somebody died, they didn't wanted to make it a big noise
Issue
about it.
out of that. Yeah.
So this social boycotting also was a big tension for the middle-aged people.
Mhm.
So they always thought that when they go back, how will be they will be welcomed, or how they will be treated, how their family will be treated, because some people were already they were reported. Their families reported that nobody is helping them, nobody is assisting them, nobody is calling them. That was a very bad part. Actually, by with maintaining social distance, you could help these people, but people were so fearful. They didn't even wanted to call on a mobile. So I think so that was the tension, that was the stress these middle-aged people were they were experiencing.
Ji. Ma'am, before this, you suggested some of the measures for the frontline workers. But what happens today is these frontline workers, I don't say they do it purposely. If I am a media person, if I am a doctor, when I am in conversation with these COVID patients or the people in general, I unknowingly give some signals of fear or the panic state. So if when you have mentioned some of the measures for these frontline workers, what would you suggest these frontline workers, that how should they behave, how should they handle these panic situations when in conversation with the COVID patients or the family members.
You are talking about press reporters.
Yeah, media, frontline
Yeah,
workers,
media people. Yeah,
hospitals,
media people.
doctors. Yeah.
Yeah. One thing I will, on this forum, I will definitely haath jod ke I will tell all the media people that please don't broadcast negative news. You know, a lot of negativity is spreading in the community, and which is impacting very negatively on the people's mindset. So whatever is true, and that can be broadcasted, that can be shown to the people. Also some success stories, positive stories, good stories, that can be broadcasted, so people get an idea of helping each other. Hmm? Today, because
Also
of
in
such stories, people.
hospitals, ma'am, doctors or the nurses, the frontline workers, those who are working for the COVID patients, they knowing unknowingly spread the panic and fear. Media does it, but I don't say they do it purposely. Uh,
Mhm.
that is part of their job. Even that is part of
Yeah.
the hospital's job. So, how can these situations be handled?
No, yeah, instead of spreading panic, or instead
Yeah,
of making forcing people to experience fear, I think so
yeah.
we should talk more on preventive measures. Yeah, we should talk on what they have to do for not being infected. Yeah, and then third thing, you have to talk about how you can go for early detection, and if you are detected positive, how you should go for treatment. I think so that is what has to be highlighted, then other negative stories.
Yeah. On that note, I'd like to conclude the talk, Smitaji. Thank you so much for joining in and giving those beautiful, those important, significant insights. I hope the people, our viewers, understand the importance of keeping the mental health in pace and consider all the significant suggestions that you have put forth today. Thank you, Smitaji, for joining in. Thank you so much.
Yeah, thank you very much. Just one line of concluding from me.
Ji.
I request all of you to keep your mind frame in a very positive way.
Ji,
Be
ji.
very positive about everything. If you are positive, you can fight any number of wars. Yeah,
Correct,
thank you very
correct.
much.
Thank you, ma'am.